3 years ago, Lior Rutenberg's young daughter, Sadie, became the first patient to receive a pediatric heart valve as a part of a clinical trial for pediatric patients 5 years old or younger with a diseased, damaged, or malfunctioning heart valve. Now, the FDA recently approved the world's smallest and only mechanical heart valve designed for newborns and infants with heart defects. Lior and Dr. Chen, who performed Sadie's surgery, join us now to share more. Welcome to both of you.
Hi.
Hello.
Hello.
Thanks for being here. So, Dr. Chen, let's start with you. Tell us about the FDA approval of the heart valve and why it's significant.
Well, the Abbott 15mm valve was available to us in the past several years, but it was under a protocol. So to get the valve to the operating room, you'd have to go through a process that involved your own hospital's institutional review board, and then you'd have to get the valve from the company. So that process took about 3 to 5 days. And so the impact now of having FDA approval is now the valve's available to us off the shelf. And you can imagine, obviously, that's a huge impact for those patients who needed emergency implants because it wasn't available before. For those kids who we are intending to replace their valve, now they don't have to wait that 3 to 5 day period to have the valve available to them, so we're operating on them sooner. And those are 3 to 5 pretty critical days in terms of risk. And then there's this other population of patients who need high-risk mitral valve repairs, as we would say, most of which we would not undertake without knowing we had a good backup. And so now, knowing that this backup option is available, I think we'll undertake more and more of those operations sooner. So in aggregate, I think the impact is going to be pretty profound.
Right. Now, are there special qualifications for a baby or an infant to qualify, like I said, for this type of surgery?
No, every infant or child should be a candidate as long as their valve size, we call the annulus, the diameter of the valve, is at least 15mm, so they can accept this valve.
Got it. Now, without this option beforehand, what was the prognosis for pediatric patients with heart defects?
I would say it was unpredictable. I think if you were lucky enough to grow and have your annulus grow enough that you could accept an adult-sized prosthesis, it was actually pretty good, as it is true for these kids. But there are a lot of kids where that waiting time, and that wait time can be weeks to months, in the ICU, asleep, on a ventilator with medications, can be pretty critical. So, you know, we sometimes would offer palliative care, even heart transplant if we had to. Mm-hmm. So it's a real game changer to have this available to us.
Absolutely. Now, Lior, you're here to share your personal story with us, and you and your wife were aware that Sadie was going to be born with heart defects. Now, what symptoms following her birth were you aware of, did you see?
She started basically just eating all the time, but not putting on any weight. She would, have difficulty sleeping or be, extremely fussy. Her skin would look a little mottled. She would be, she would start sweating just doing things like eating or rolling over. And you could tell about 2 to 3 months that there just something wasn't not right.
Right, and she's had the surgery. Luckily, she did well in the surgery. And how's she doing now?
You wouldn't even know it looking at her that she'd been through the operation she'd been through. I mean, it's a complete game changer. Once she got the Abbott valve, it was she was off to the races, and she does all the things that you would expect from a 3-year-old now. She goes to the zoo with her parents and looks at the giraffes and penguins, and she goes to the playground and scares us to death climbing on the jungle gym, and she's just the happiest, most vibrant little girl that doesn't seem fazed by this at all. She's gonna keep on going no matter what.
Well, she is such a little cutie. It's so great to see that smile on her face, and she's going to go on now to live a long, healthy life. And I'm sure you, as her father, and for your family, it must have meant the world.
It did. I mean, when you talk about what we went through and all the people that we've met and the experiences that we've had at this point, going through this and having the experience, it's for some people it serves as inspiration. We're hoping that we can continue to do that and reach out to people and let them know that things like this are possible. There are people like Dr. Chen and the people at Seattle Children's that make these things possible, and the Abbott company that make these devices. You don't know about it until you need them, but you can sleep well at night knowing that they're out there now.
Good way to put it. It's a full team effort. So, Dr. Chen, if people want to learn more information, where can they go get it?
The best comprehensive site is probably Abbott.com about the valve. But for families with kids who have congenital heart disease, I think most know this, but there are lots of support groups, chat sites, Facebook sites that are as important, because parents will tell parents things that are probably more important than what doctors and nurses can possibly tell them.
Right, good point. Well, Dr. Chen and Lior, thank you so much for joining us. Lior, thanks for sharing your personal story.
Thanks for having us.
Absolutely. Stay right where you are. We'll be right back.